Okay. So you're welcome, Dr. Ambika. I'm so glad that you are here. So giving a formal invitation and your introduction, you're a registered rehabilitation counselor, founder of Ananda Center for Counseling Psychologist. You're a psychotherapist, certified relationship consultant, parenting expert. I think people really need people like you, and a career counseling expert. I've seen that a lot of internships too, especially the psychologists from various institutes and universities, they do internship under you, right?
That's right.
This is what I know. I want if you can give a brief about yourself, what you do, how you have inculcated all the modalities which you do. Just give a brief about yourself because it's long been connecting with you. I want to hear what you are doing.
True. Thank you so much, Dr. Gagandip Kaur, for inviting me for this lovely conversation that we are about to have. And thank you for introducing me very nicely and crisply. I have been working with psychology and related aspects for over a decade now. And it all started with me learning EFT tapping.
Yeah.
And this was somewhere in 2011. And that was the time when EFT tapping was not as known as it is known now. And I did EFT tapping for a small issue that I was facing. So somebody introduced me to EFT tapping and they said, why don't you try it? And I did tapping for 3 days. And at that time in India, there was nobody who would do EFT tapping. So I picked it up online. And to be precise, it was Nick Otner's tapping that I had uh, stumbled upon. So I went through tapping solutions. I looked up at his videos and he was explaining it so beautifully, Nick and Jessica Otner. And that really helped me. And of course, this was the pre online era. And I started learning through their videos. I started getting in touch with people who would do EFT tapping. That's how I picked up EFT tapping. And I did want to do a certification. And then I realized it was way too expensive to do a certification from them. And also, I had to travel to the US, which was not possible since the family is here. My son was very young at that time. But nonetheless, I picked up EFT tapping. After that, I learned our age old traditional system, which I knew about a little bit, called the Marma Chikitsa.
Marma Chikitsa.
And then, and then I realized there is so much of similarity and connection in Marma and EFT. Then I started going back and understanding what Marma is, going to the root of Marma. And that's how I got into the other modalities of helping people when they are emotionally down, or even using this as a maintenance system. I always say Marma or EFT tapping, do not call them as therapies, call them as a mechanism for sustenance. Because you use it on a daily basis and you're good to go. It's like walking on a daily basis. We don't walk when our blood pressure is high. We walk so that the blood pressure doesn't go high.
Absolutely.
So this was my starting point. And then I did my psychology masters to have that certificate. And of course, I incorporate EFT tapping and Marma into my psychology related clients as well into my therapies. And you very rightly introduced me. I am a relationship consultant. I am a parenting educator. I am a career counselor. I have learned the modalities of CBT, compassion focused therapy, acceptance commitment therapy, and those as well from Feeling Minds. So, this is my journey, and here I am today. And now I plan to start a small initiative for college students so that they have affordable counseling at hand, because otherwise counseling is an expensive affair, no doubt about it. So I'm in the plan of initiating that with college students, and this is purely for college students.
Wonderful. Wonderful.
So
Plans.
this is me.
So what exactly Mamra is like? What you do? What are the actions like? Because EFT is, I know it's a talk and a tap therapy where we tap on a certain meridian points and then we do the affirmations. We work with the emotional patterns. So how you do with Mamra ancient? You said it's an ancient technology. So if you can give a little
That's right.
light on what, from where it is coming, and how, what kind of a benefits people can take out of that.
Absolutely. So Marma is, we have areas of Marma in our body. It is a natural system. It's an energy system, purely an energy system. And this is more ancient than acupressure and acupuncture.
Okay. Okay. Just to stop
So,
you, just to stop, because viewers, they must not be knowing about what is an energy system. So if you can give us an idea about what's the difference between a normal physiology system and an energy system.
correct. So when we work on the physiology system, we are anatomically connected. We say, oh, we work on the heart, we work on the lungs, we work on fingers, we work on head. But when we talk about energy system, there is something that keeps us alive beyond our organs and parts and systems, right? And in English, we call it life force. And in Sanskrit, we call it prana.
Yeah. Yeah.
So ideally, there is no literal translation of prana into any other language, and which is okay, I guess. So this prana is what keeps us alive.
Absolutely.
And when the prana starts moving and when there is activity in a human being or in any living organism, there is another aspect that comes into play, which is called the vayu. So without Vayu, there is no activity. Even if there is prana, without Vayu, there is no activity. Which is why when we do something, we say Pran Vayu hona zaruri hai. Or it is important that we have the Pran Vayu. So this is the energy we are talking about. And we all know, and we all very colloquially or in very simple terms, we keep saying, oh, I'm so down on energy. Correct. We know that we are functional. We know that our body is working, but there is something that is not helping us come up to that mood. And we know that emotionally we are fine, but we just say, oh, my energy is so drained. So that is the energy we're talking. And when that energy gets up and starts flowing properly, we come back to our normal selves. And now this energy has come into the domain of psychology as well. So there was a time when everybody thought that, the thoughts, emotions, and the mental faculties are different from the physical part. So we would only treat the emotions or the mental issues, if there is any, and treat the body separately. But we all realize that everything begins from here and it trickles down.
Very true.
So now it has become one part, and that's why energy psychology is becoming so, so helpful.
Yeah.
So Marma are, like you asked the question, they are the vital, to put it in a very simple way, these are the conjunctions or the areas where multiple things come together. When you stimulate those areas, a particular problem or a particular emotion starts getting addressed.
Okay.
So in Marma, we say there are 72,000 nadis. So nadis are not veins, they are not nerves, they are subtle energy flowing systems. Like in acupuncture, we say there are 12 meridians. And the acupressure or the acupuncture points are on these meridians. Similarly, across this network of 72,000 nadis, we have Marma points, rather Marma areas. So depending upon the Marma, it could be as small as the tip of our little finger to the size of our fist.
Oh.
So that is how we stimulate. And Marma is very well known in the southern part of the country because it is used a lot for healing. And there is this martial arts in Kerala called the Kalaripayattu. So they use Marma both in the battle and to heal. So when you use pressure on Marma points, it can be fatal. When you have very simple touch on Marma points, it heals us.
Wow.
So
And
it heals us
how we touch it? Like is it with the hands or with some kind of a
with the
device?
hands.
Oh.
No, with the hands, the fingertips. And the way we measure the Marma areas is with our own fingers.
Okay.
So a common problem all of us have, I'm deliberately taking a physical problem, is, pain in the neck,
Yeah.
the cervical. So the way we measure is you take the four fingers, put them here, and where the middle finger comes, that is the point, and you stimulate the point 18 times. Like 1, 2, 3, 4, 5, 6, go up to 80. Ladies would do it on the left first and on the right, and it really relaxes this area.
Yeah. Yeah, even I was
So
touching,
this is
there is some kind of a congestion or hurt if I ever may. It's obviously we do have,
true.
all of us do have. This is something which is this era people are carrying. Okay,
True. And
that's,
we're so busy with our gadgets.
yeah,
Sometimes it is necessary, sometimes it is indulgence, but
yeah.
nonetheless, we are using it. So, this is how Marma works. So, we have points on our heads, we have points on our hands. When we stimulate them, it calms the mind, it allows us to breathe even more openly. And then our emotional issues also start getting addressed. Because when we are able to think properly, articulate things, we are able to come out of it.
Absolutely, yes. I
So
can
this is
relate to it.
Marma in a nutshell.
It's quite related with EFT, quite related.
Yes,
But
yes,
it's good
indeed.
to understand that there are these sciences, these ancient sciences are somewhere connected to the roots, ancient roots. It's all coming and
Yes,
emerging with various names are there, but overall the technology is being targeting the same kind of pedagogy.
correct. Very true,
Wonderful.
very true. In fact, there are literatures which say that, acupressure and acupuncture has come out of Marma because
Yeah.
Marma dates back to the era of Ayurveda.
Hmm.
It's not a part of Ayurveda, but in Ayurveda literature it is mentioned because the Ayurvedic doctors or the surgeons are very specifically told never to have a surgery on a spot of marma because it can be fatal.
Oh. So it has to be
So that
under
is how,
proper
yes,
practices. And
correct,
in
correct.
northern side, I think very few people know about these kind of
True. Yes,
wonderful.
very true. So there
So,
is one Dr. Sunil Joshi in Haridwar. He
hmm.
is a great, great proponent of marma. He is an Ayurvedic surgeon himself.
Oh.
So I have learned marma from him.
Mm. Very good to know because this is something new for me.
Yes.
Okay, so how many, like, if you can give us an idea, like what kind of issues or patients you have, taken care under this technology and how it exactly worked, what kind of a situation they two came initially, and what was the impact of this intervention afterwards? What was being cured? Is it a root level, the cause is being done, root level, the problem goes with Marma, or or people needs a regular interventions of Marma sessions or something like that?
So what happens is, yes, of course, we address the root issue because as we go down, we understand the reason for the emotion to come up.
Yeah.
Although it may stem out or come out as anger, the
Hmm.
root cause may be fear.
Absolutely.
Correct. So when we understand what that fear is about, why did that fear come, and when we are able to use Marma or even EFT tapping,
Hmm.
it gets alleviated, and then we teach the basic of Marma to them so that they can continue doing it.
Okay.
It is like in CBT, we teach them thought journaling,
Hmm.
right? So similarly, we teach them Marma. So we call them for 5 days. After 5 days, we start tapering it based upon how they are responding. If I'm using just Marma, this is how I work with them. So
Hmm.
usually people with no, I'm talking about non-clinical population right now.
Okay.
People with anxiousness or extreme sadness, extreme grief, or extreme hurt, it really works. And it works for children when they come with lack of concentration, lack of sleep. It works beautifully for carpal tunnel syndrome,
What's that?
which is a big problem. Carpal tunnel syndrome, because of using the mouse and the keypad, they have a pain in this area.
Oh, okay.
So that's a pure physical problem that can be helped easily and quickly. And there is no medicine, there is no equipment or apparatus used. It is your own finger, it is your own body.
Hmm.
So either it works or it doesn't work.
Hmm.
Like EFT, there is no fatality involved in this.
Yeah.
So this is where I use, and I use Marma with people when they come and they say, I just do not know where things have started, and when they're not able to articulate.
Yeah.
So there are a couple of points in the head that I stimulate for them.
Hmm.
Once they calm down, then I start my session. So
Okay.
at times I use Marma as a stepping stone into the session. At times that is the only thing I use.
Hmm.
This is how I work.
Wonderful. So that's wonderful to hear about these kind of techniques. So I want to take the conversation to another side of it as being a psychologist, you're also masters in this. Just want to understand because somewhere I was going through and I read an article that these days, people like you and me, we are being victim of this, the big data and the information which is coming on social media. And they are using psychologically, they are using our minds. Psychologically, they create certain kind of content which is actually damaging us. I have usually
Yes.
seen, yes, people say that your phone is listening to you, and psychologically they can understand their viewers and they create content. Intention is not to damage, but definitely people are being, they're damaging themselves. So what you want to say on this, and what is your, intake and understanding about being a psychologist on this upfront, that how a layman person, how a person who is actually not knowing anything about this can see and have the prospect and a perception to see that, yes, this is what the AI and the new tools are coming up, where, somewhere in the back end, your psychology is working against you.
True, true. It is like you're going to sabotage yourself or something
Exactly,
like that.
exactly, exactly, exactly.
Correct. So this is where I think we need to help, especially the youngsters, to
Hmm.
work on their own self-esteem
Yeah.
and self-worth. Because this is how they slowly lose confidence, and this is how they fall prey to social media constantly, and then compare with that social media, uh, what do I say, expression of how a human being has to be.
Hmm.
So it is very important for all of us to have an anchor in us. When that anchor doesn't happen to be there,
Hmm.
we start looking for external validation constantly. I'm not saying external validation should not be there. Of course, all of us love external
Hmm.
validation.
Hmm.
But should it always be the external validation?
Hmm.
When will we learn to look inside? So
Hmm.
rather than living a shallow life, how can we get in depth into us?
Hmm.
That is something I would love youngsters to start exploring.
And how
And
you teach them, what tools you use them to give them a tool, a ready tool, so that they can be more conscious about, what kind of emotional setup they do have.
so one is I talk to them a lot and
Hmm.
talking in their language.
Yeah.
Of course, the languages keep changing every 5 years, right? The acronyms that they come up with. So if I do not know, I allow them to teach.
Hmm.
And then we get into a question answer session to understand how much is it helping them.
Yeah.
So recently I had a bunch of 17 students, all youngsters, undergraduates, very bubbly group.
Hmm.
So it wasn't easy for me to begin because they came from a completely different space. I am from a completely different space. And obviously, both of us are going to have our own biases.
Exactly.
But
Hmm.
then when I become that child, then I understand how wrong Ambika Warrior is. Correct. So when we are able to see that, that is when they're ready to listen to us. A lot of question answers help, and question is, to help my curiosity, not to question them.
Yeah.
If I am curious, I'm able to get their answers, and as they answer, Dr. Gagandeep, it is easy for them to understand where they're going wrong.
Yeah.
They are very intelligent, they are very open to change. It's
Hmm.
just that how can we help them into that change.
Beautifully
So
articulated.
I
I really
thank you.
that, this is wonderful to hear, that yes, somewhere we have to lose the learnings of what we can understand, and seeing from that kind of a mirror, we have to bring ourselves at their level. So what is the common thing which you can understand? What was the common hearing or listening you got from them? that, they want to say?
The common hearing or listening is, for some reason they feel incomplete. For some reason they feel unhappy even when they have most of the things that they want materialistically. And for some reason they do not know what they want.
Very true.
So obviously all these children are going to ask, can you tell me what I want? And I cannot tell them what they want because it is their quest, not mine. So that's where we need to show them the path to walk, but they have to walk. That is when I introduce maybe EFT tapping by explaining it to them and giving them a choice whether you want to explore it, giving them a choice whether you want to explore Marma so that you feel calm and then you get ideas of what you wish to do in life. It's like doing career counseling.
Yeah.
You give them the options that have come out the best for them and allow them to explore. The final decision is theirs, not mine. That is where I introduce mindfulness or, compassion focused therapy, techniques of compassion focused therapy. So I feel there is no one method that can help everyone. Why don't we give a toolbox and let people see what works?
Absolutely. I can relate that because we are different human beings, understanding and having a different way, various levels we are on. It's a journey for all of
True.
us.
Yes, yes.
Wonderful. Okay, I just want to ask one thing, that somewhere you've mentioned evidence-based practice in contrast to practice-based evidence. So I was going through your LinkedIn profile and I got to know these lines. So I was very curious to know this from you.
True. So what happens is we are all looking for scientific, evidence-based practices. But how will I have evidences unless I practice?
Like EFT is an evidence-based practice, if you can say.
Yes, but somebody practiced EFT, which is why it became evidence-based, right?
Yeah.
So if you and me don't talk to, let's say we are two individuals and you are an EFT expert and I do not know it, unless you teach it to me and I practice, would you have an evidence that it works?
Very true.
But we are all looking for evidence everywhere. But that evidence would come, it's like the chicken and the egg.
Yeah.
Correct. So
how to sensitize people on this, if you can suggest, because I know this is really
yes,
important.
because otherwise it is called pseudoscience at times. It is called multiple other things, which is fine. But then allow people to experience after explaining what it is. This is what I personally think, and this is what I have been doing since 2011. And I'm really proud to say that I'm the first Indian to have a paper published in a journal on EFT tapping.
Wow, wonderful. I got your paper. Your paper was my base paper when I was doing my research long back. I know that, and you have shared all your thesis. I can, you being very generous at that point of time, and I was not having anyone across India and abroad not finding a proper paper. You were the one who shared all, whole thesis with me. So thank you very much, because my study also generated from there only. So what was
it
this
was a
study?
lovely
What was this
conversation
study?
we had.
Yeah. So can you tell us what was that study you've done long back, if you can just
Yes.
put a light on that also?
So this was way back in 2016, and I worked on anxiety. And I had taken the state rate anxiety test as the measure, as the assessment tool, and WHO's quality of life. So I compared the anxiety and quality of life. And my hypothesis was, when the anxiety is high, quality of life is low, and vice versa. And I would use EFT as an intervention and then see if there is a change. Again, when anxiety goes down, quality of life goes up. So this is what I did, and I did group tapping because I did not have time to do individual tapping. So it was small groups of 8 to 10 people that I would take, and I did over a period of 2 weeks. I did 3 sessions of tapping with them. I answered all their questions and answers. It was just tapping, nothing else at all. And there was a significant difference in anxiety. Their anxiety lowered and their quality of life came up. So it was such an achievement, and I felt so nice.
I can resonate that, because similar feeling I had when I completed my research work. And we can find there are series of meta-analysis and research on EFT. Still, it is being done. And people now,
Yes.
they're being very curious. You can find a lot of research papers and content on various platforms like EFT International, tapping solutions are there. So
True, true.
good
What
that
was your paper on?
my paper was totally focused on their placement success, management students' placement success, where their
Ah,
anxiety, stress levels, their performance, their, as seeing their own performance level, and particularly when they're
mm,
sitting in front of an interviewer.
mm,
I took up scales related to their performance, related to their calmness, how calm they are inside their body. So I also collected 2, 3 questionnaire from DAS WHO. Scale was
okay.
there. Then I created my own scale, and then I did a lot of workshops. Like I remember there were 3 years I was only doing group sessions with students, and collected a huge data of more than 2,000 students, and then worked on a
Mhm.
statistical tool of SPSS, and my results were amazing. So I know this whole
Lovely.
journey was wonderful. And even I was fortunate to present my thesis in 2022 EFT International Symposium. And I was being the only Indian
Lovely.
out of 80 countries to represent this, my thesis.
Wow. Such a proud moment.
Yeah, it was.
Congratulations.
Yeah, it was wonderful moment for me. And after that, yes, I was more into this. But other than that, I was using other modalities, as you said, that we can use there's amalgamation of various kind of modalities and
Correct.
understandings. And yes, there is a sense of an intention and intuition when you are in this field, that how you need to
Yes.
proceed with various kind of clients and students. And majorly my clientele is also students, because my journey started with universities and students. Now I have turned into corporate sector, but definitely I use the same modalities and tweak these modalities in the corporate
Mm,
sessions, because
correct.
I think students or the youngsters, they can still have some kind of a vent out process. they
Mm,
they do a lot of exercise, they do a lot of freaking, they go out, they can vent out the emotions. But when you see the corporate people, they have put themselves in a structure which is very confined. So they need in a
true.
very, very high level, they need really, really high these kind of modalities, if they can understand. But we
Yes.
have a very, what we call a psychological barrier also, that they see as a pseudoscience, these kind of modalities.
Mm,
Wonderful,
yeah.
wonderful. So how about you being associated, or you being using these kind of modalities only with the student community? Who's your target people?
So again, like you said, it is very intuitive when we start talking to a client, right?
Mm,
So based upon what they could accept, I use EFT. I think most of the times it is very easy for me to slip into the EFT mode.
mm,
It is pretty much my go-to place when I feel that this person is very resistant.
mm,
Because clients come with a lot of baggage, and I understand they do not know how to open up and whether to open up. They are like, yeah, I took your appointment. I'm sitting here in front of you, but I
mm,
really do not know if I'm ready to talk to you.
mm,
And that doesn't make them feel nice and us feel nice,
mm,
because they want help. We are trying to help, but there is a huge wall in between.
mm,
So that wall can be broken down with this EFT. And I personally feel, Dr. Gagandeep, that the EFT statements bypasses the conscious mind. So that barrier just falls down,
mm,
because we are talking about what they have told us and what they're going through.
mm.
So they are not judging those statements.
Yeah,
And we are just giving them back what they told us. It's nothing from our side.
yeah.
It's not a story we are making, it is the story they gave us.
Mm.
We are just putting it into some kind of a perspective and handing it back to them.
It's actually
So
like
that,
just being a mirror to them.
yes, correct. And then suddenly they start telling, oh, I never thought of it like this, but that statement which you said
Hmm.
was so correct. I could not put it into words.
Hmm.
So I personally feel that it is able to bypass that conscious mind barrier, that analytical mind barrier,
Hmm.
and then they open up. And then, of course, we can use any other modality if we wish to use.
Yeah. So what you want to say to the people and basically the youngsters and the students that, although they are being impacted, they are in influence of everything, but still they don't want to listen. How we can deal with these kind of situations? So what will be your agenda for them?
Yeah, that's a very, very difficult space for them and us to be in,
Exactly.
because
Exactly.
it's constant tug of war for us.
Yeah. And maybe
Eventually,
even for them also, right?
yes, yes.
Mm.
So something that I openly tell the youngsters, because they understand is, we have two options: either to stay the way we are
Mm.
or to get better. To
Mm.
stay the way you are, you didn't have to come to me. You're doing it probably very well.
Mm.
Correct, which is why you have come here. And it is not a sarcastic statement, also.
Mm.
I mean it. You don't need to be here to be the way you want to be.
Mm.
But if you want to change, you need to allow yourself to get into that change. So the
Mm.
first step was to come to someone, whoever it is, me
Yeah.
or someone else.
Mm.
You have done that. Now allow that person to help you.
Absolutely.
Unless you allow, I cannot help.
Mm.
Even a doctor can prescribe medicine. Your parents can get you medicine, but you have to gulp it down.
Mm.
That is the commitment you have to take. So
Absolutely.
once you have that commitment, then we can go ahead and we can meet again. If
Hmm.
you think you are not yet ready for that commitment, think about it.
True. Very true. Very true. And I think when you have these kind of a direct talks, like whether they are committed for themselves and whether they have an eye to see that, they want to make a change and want to make a shift in their, present existing state of mind, then only they can
Right.
see that prospect. Yes, yes, now I can be open, with the person, and the person is ready and in a place to help me. Because
True.
most of the time they want to tell their perception and their understanding. They don't want to listen. They are not in a frame of listening. That's my
Yes.
my experience. So this is a very good way and approach to move forward with them. Thank you for sharing that. So we had a wonderful conversation. Thank you so much. Although I do want to have a long, long conversation, I have a lot of things to, related to these topics. We can go and go on and on talking about this. But I have kept, these resonate reflections, a short duration of an interview and reflections, so that, we can grasp certain things and can connect with the people. So we look forward
True.
that people, if they want to connect, you just give us an idea where people can connect with you, how they can contact you. Just give us an, before leaving, you can just give us an idea about that, how people can connect to you.
Yeah, sure. Of course, my LinkedIn is there. If somebody wants to connect, they can surely send a message, or they can send an email on info@anandacounseling.in. So Ananda is with a AANANDACOUNSELLING.in. These are the two methods that they can connect with me, and I'll surely reply to them. And I hope that everybody has an anchor within, so that they are stable, they are grounded, and eventually they are happy and joyous.
Yeah.
And it was a lovely time talking to you after, I think, few years we got connected.
Yeah.
Yeah, it was really nice. A
Yeah.
crisp conversation, and wishing you all the best to bring in all the other people and give plethora of things for people to work with themselves.
Thank
Wish
you
you
so
all the
much.
best.
Thank you so much for your time. Thank you. And the wonderful conversation. Thank you. Thank
Thank you.